Good morning, everyone. Good morning. It's such a pleasure to have so many of you here with us this morning at Annabelle's. A very big thank you for coming to join us this morning. I'm Francesca Ogyeman-White, and I'm the founder of the Beauty Triangle. Now, we're here this morning to discuss the new face, whatever that means to each of us. After all, as time goes by, our faces evolve, but so too does our perspective on aging, on beauty, and actually what it means to look like ourselves. So what are the most modern routes to undetectable intervention? And how do we know which trends are fleeting, passing, and which treatments and therapies are truly here to stay and that work? Now, when we launched the Beauty Triangle, it was to educate and empower our consumer audiences, such as yourselves, on all aspects of their health and well-being, and always critically from a holistic standpoint. But we also wanted to introduce you to the most authoritative experts, such as my incredible female panel who I have up here with me this morning, and make sure that you get the most trusted information so that you can make safe decisions that are ultimately going to benefit you when it comes to your well-being. On that note, it gives me great pleasure to introduce this morning's speakers. I'm joined by aesthetic practitioner and regenerative expert, Dr. Yusra Al-Mukhtar. I'm joined by consultant plastic surgeon, Miss Monica Fawzy, and finally, Korean facialist and all-round skin expert, Mina Lee. And altogether, we're going to be taking a bit of a deep dive into the new face fixes that prioritize innovation, cellular health, and really the most natural aesthetic that we can get for our faces yet, whether that's the latest lasers, cutting-edge topical ingredients, or even the new fresh wave of facelifting techniques that are very exciting right now. We're going to have time for questions at the end, so please do save anything up that you want to ask our speakers, and we'll come to those. And hopefully you found a program at your place setting, so you can learn a little bit more about all of our panelists there. And I'm sure you also won't have missed the amazing skincare that's at your place setting. Oh, hello? Oh, yeah, we're back. Technical glitch. It's an amazing brand called Piderin. My face is obsessed with it at the moment. I think you're going to love it. You're going to be hearing more about Piderin and PDRN, the key ingredient, from Mina at the end of the talk as well. So don't forget any of that. But suffice to say, that's probably enough from me. I'm going to hand over to our panelists. They're going to say a very quick hello, introduce themselves, and then we'll get started with the main conversation. So, Yusra.
Hi, everyone. What a pleasure to be here today amongst all these amazing women. My name is Dr. Yusra Al-Mukhtar. My background's in dental, oral, maxillofacial surgery. I've been practicing for the last 16 years, and I have 3 clinics, one in London, Fitzrovia, one in Liverpool by the beach, and one in Manchester. I also have 3 children, so my days are very busy. And I do a range of non-surgical facial rejuvenation treatments, and I work alongside some experts in their own rights. From gynecologists, one of Miss Mina Lee is here with me today, who's a gynecologist. We have hair loss experts, weight loss experts at the clinic, and we do a lot of aesthetic and wellness treatments. Over to you.
Thank you, Yusra. Monica, hi.
Good morning. So my name is Monica Fawzy. I am a plastic surgeon, and I basically split my week between the NHS, where I do head and neck reconstruction, facial palsy, reanimation, and then the second half of my week is face and neck lifts. That's, pretty much it. And I'm based in central London, so I work at the Marylebone Hospital.
Excellent. I've got many questions for you, don't worry. My face is, on your agenda. Mina.
Hello, everyone. So my name is Mina Lee. I am not doctor like both of you. I am a holistic healing facialist. I've been doing facial for the last 20 years, and then I'm sure I can give you some expert over what I have from the experience for you guys today.
Thanks so much, Mina. Mina has magic hands. I'm really excited for you to hear all from her as well. So she's introduced herself, but our first speaker is Dr. Yusra. Yes, as you mentioned, 3 clinics, 3 children, a very, very busy lady. She's flying out to Egypt this evening, so we're very privileged to have her. Yusra also has a real passion for where the skin meets the psyche, which I always find endlessly interesting. But Yusra, maybe you can start by telling us a little bit about what you're noticing in practice, because you've been treating the face for a decade and a half, I believe. I'm really interested to know how you've seen consumer demand shift, whether that's emotionally or even psychologically.
It's a really interesting question. Definitely, there has been a shift over time. And because I practice in 3 different locations in the UK, I think there's a lot of nuance and cultural differences as well in these different areas. Gone are the days where patients were coming in asking for more and more. That was something that we saw a lot, particularly in Liverpool. I don't see that so much anymore, thankfully. We've shifted. And I think the shift has been one where the industry has also shifted away from being an industry focused on vanity alone to being an industry focused on wellness. And with that, so have the consumers. Now we're seeing the educated, what I call skin consumer, who's coming in a little bit more knowledgeable about different treatments, but also not wanting to just look good or feel good, but actually be good. You know, they want optimization. They know that they're hopefully going to live longer because modern medicine means we're going to live longer, but they want to live with strength. They want to be healthy. They want their skin to be healthy. They understand that form and function and skin health comes first, and that's where aesthetics comes from, rather than just masking aging.
I love that you picked up on the fact that it used to sort of feel like we were asking for something that was about vanity and more superficial in a sense, and now we are talking much more about skin health, about wellness, about longevity, all of these things that actually I think get to the crux of why we have these treatments and why we do put our faces front and center a lot of the time. To what extent do you think things like social media, AI have really sort of steered this shift as well for consumers, because we are all so wildly educated yet confused at the same time, I would say.
Oh, 100%. I think the reality is the sphere of influence our patients are exposed to is social media. And everyone and anyone has an opinion. And I'll say this, and I hope that nobody takes offense, but I say this quite a lot. Opinions are like buttholes. Everyone's got one. And the issue with the online world is that there's no scientific rigor. There's no credibility. Anyone can come online and share their opinion. And that's fine. That's their prerogative. But it's not always true. And so as clinicians, we are now navigating quite a noisy field. And patients are coming in educated to a certain extent, but conflicted because the noise and the opinions are conflicting online. And so we're having to unpick this misinformation, and there's a plethora of misinformation online that is unfortunately negatively impacting patients. So part of it is, it's great, social media is a means, it's information, but not always the right information.
It's that double-edged sword, isn't it? You know, trying to unpick the misinformation, as you say. And sort of in lockstep with that, obviously, we're spending so much more time on the digital devices, the screens, the blue light. What's that doing for you as a practitioner, and how are you then sort of helping the patient with their skin and sort of supporting their faces?
God, there's so much to speak about here. First and foremost, I think when you're talking about social media, one of the things that we really need to talk about, I think, is filters, okay? Because you can't inject your way out of a filter. You can't facelift your way out of a filter. And Kim Jenner, is that her name? Kylie Jenner? Kim Kardashian's mom, what's her name?
I don't know. I'm sorry.
Kris Jenner.
Thank God everyone here is better at pop culture than me.
And her facelift was great, and then everyone started talking about the fact that the facelift wasn't great, and it's all dropping. And actually, her facelift surgeon did a very good job. And the reality is, what we were all seeing was a filtered version of that facelift, which is unachievable. You know, no matter how much Botox or filler or facelift surgery you have, filters are not real. So
there's a degree of dishonesty as well with social media.
Yeah, perception dissonance between reality and what is achievable. And I think that's something that, whilst I'm really appreciative of the fact that many of these celebrities are talking openly about the treatments that they're having, the filters are not helping because they're creating unrealistic expectations for patients. So that's one aspect of it. Then the other thing regarding blue light and light, I see a lot of patients who come in and say, oh, I don't wear sunscreen every day. And at this day and age, it's quite shocking for me. But it's because people think that if they're sitting at home and they're not out and about, then they don't need to wear sunscreen. And the reality is, you know, if you've got a window, and most of us have windows in our rooms, sunlight is coming through those windows, whether it's a gray day, a snowy day, a raining day, you need to wear sunscreen because UV light, we all know, undebatable, not an opinion, this is fact, is that UV will cause cellular damage to your skin. Now, blue light will also cause cellular damage to the skin. It's part of the exposome that we are exposing ourselves to, right? So we've got UV light, you have pollution, you have blue light. It's kind of a secondary factor, it's not primary, but we know that blue light from our screens can impact the skin health by causing inflammation, reactive oxygen species, photoaging, hyperpigmentation. So my advice to anybody who is sitting at home, working from home on a screen, you still need to wear your sunscreen. try and use a tinted sunscreen because they have iron oxides in them and they help to protect against visible light, which is basically what the blue light spectrum is from.
I've even heard of female hair loss now at the sort of front of the temporal region from purely sort of looking at the phone so much and seeing that sort of shone onto the hair. It's what a lot of hair transplant surgeons are now sort of talking about, which is fascinating. Tell us a little bit about regenerative treatments, because this is something you're doing a huge amount of in your 3 clinics. Why are these so relevant when we're in pursuit of the new face?
You know, when I think about new face, I think of timeless face. I think, how are we going to help our patients to have healthy skin and a beautiful face for longer? So I'm thinking timeless. When it comes to regeneration, that's what it's all about, really. It's about optimizing function. So some people have heard of functional medicine. I call what we do functional aesthetics. And the idea is that when we're talking about true regeneration, the definition of true regeneration is reverse engineering aging to a certain extent and optimizing the cellular function and the entire ecosystem of the skin, because it's not just collagen, there's elastin and proteoglycans and sugar molecules that make up that entire ecosystem. Regeneration is about reversing that aging pathway and optimizing the form and function of the tissue so that the entire ecosystem is as it once was. And I definitely think regeneration is here to stay. There's lots of different regenerative treatments that we are performing, from polynucleotides to even, by the way, microneedling, which is tried, tested. Again, fact, not fiction, not feeling, is a treatment that can stimulate your body to start to repair and stimulate collagen production.
I think that's what's interesting about the regenerative category. It's not necessarily new. As much as we're all talking about it and saying how exciting, new treatments, new products, a lot of these have stood the test of time.
Yeah.
Some of these regenerative products have been around for sort of decades, in fact, but it's almost the way that we're reframing it and finding new applications for them that make it feel new, and that's exciting.
Yeah, I mean, one of the examples is polynucleotides, right? So Francesca and I actually went to Italy together to go to the lab that makes polynucleotides. So polynucleotides have been around. Who's heard of polynucleotides? Raise your hands. Okay, so everyone here. So polynucleotides are little strands of DNA that are extracted from either salmon or trout, either sperm or gonad. Sounds really weird, but you know, the fish were not masturbated to get the sperm. They were actually taken as part of the food chain, and then the gonads that were going to be thrown away are taken, and DNA is extracted from there, sterilized, purified, and then, yes, injected into tissues. Now, this has actually been around in medicine for a very long time, 75 years. It was first brought to market in the 1950s, and there are over 90 different publications about it with different layers of evidence, but it was first used for wound repair, burns, diabetic ulcers that were not healing, and then kind of moved into aesthetics over the last decade. It's also been used in the dental field. And what they do is, when injected, they stimulate fibroblasts, which are the cells that make collagen and elastin and extracellular matrix, to proliferate. So you get more and more of them, and they start to lay down more collagen, but also they downregulate inflammation in the tissue. So you have reduction in inflammation. And one of the things that happens with aging is chronic inflammation in the absence of disease or injury. So it's a great tool in our toolkit for priming the skin. It's not the only tool, but it's a tool.
What are the other regenerative products that you're working with? Polynucleotides is obviously one of them, and it does amazing things for under the eyes, I have to say.
Sculptra, Radiesse, and these are kind of biostimulators. So they're, regeneration, biostimulation is kind of slightly different in that when we're injecting something like PLLA, which is Sculptra, or Radiesse, which is calcium hydroxyapatite, these are foreign bodies to a certain extent, although they're biocompatible. They stimulate some form of wound healing response in the tissues, and they cause an abundance of new collagen. We now know that they cause an abundance of elastin as well, and with PLLA, fat. So it stimulates a process called adipogenesis, so you get more fat in the tissues, which is very helpful for patients who are losing weight. I have a lot of patients on GLP-1, Mounjaro, Ozempic. I'm not going to ask for a show of hands, but many, many people are on that. And that will cause really a changing face, right?
Well, this is another new face I think we have to be contending with nowadays, isn't it? We want to lose the weight off our body, but it will naturally come off the face, and so that presents another opportunity to use these wonderful products.
Another opportunity, another challenge. When we're losing weight rapidly, the fat cells, not just underneath the skin, but actually within the dermis, scientists have found that within the dermis you have a specific type of fat cell called the DWAT, or dermal white adipose tissue, which is important for cellular communication, wound healing, luminosity to the skin, it releases triglycerides, fatty acids, and when you lose that, your skin starts to look lackluster, it looks a little bit dehydrated, looks a little bit older. So patients are coming in with their newfound bodies, but with older faces, and they're seeing that change and they don't like that change. So Sculptra presents an opportunity to treat that, because what we now know is that it's stimulating fat, it's changing the epigenetic profile of the tissues. But there's a lot of nuance, and there isn't a one-size-fits-all, and my conversation with my patients is very bespoke and personalized, and there's a conversation of, are you thinking of a facelift? And if you are, maybe this isn't the right treatment for you, and maybe this is the right treatment for you. So
Let me introduce you to Monica.
exactly. So yeah, Sculptra, Radiesse, lasers.
Yeah, what about lasers? Because obviously we've been talking a lot about the injectable category, but injectables aren't for everyone. And a lot of the time you can achieve similar regenerative means through using a laser.
Yeah.
What are you using right now in clinic that you're getting those sort of lovely, luminous, smooth results from?
So we have a range of different lasers in our clinic. Again, there isn't a one-size-fits-all. It depends on the degree of downtime and transformation our patients want. So I have the CO2 laser, which is a carbon dioxide laser. This is what we call an ablative laser. It's a hot laser. When you apply this on the skin, we're basically vaporizing the upper layer of the skin. Sounds scary. It doesn't have to look like Samantha from Sex and the City. But I think gone are the days where we're doing full ablative lasers, under general anesthetic. These are high-risk procedures with high transformation rates, but high risk of infection and scarring and so on, but truly transformative. Now, the vast majority of patients don't need that. What they would benefit from is what we call a fractional ablative laser. And a fractional ablative laser is essentially a fraction of 100%. So you might zap the skin, so vaporize a little bit of skin, keep some healthy skin, zap again. And one of the fears that we used to have around lasers was that skin of color, like myself, I'm dark skin, dark hair, dark eyes, would pigment with lasers. I've had CO2 laser pretty much every year over the last 4 years, safely, but again, there's nuance, and you have got to treat the skin with care and choose the right laser for the right patient, the right settings for the right patient. So you can have a fractional CO2 ablative laser that can improve lines, texture, pores, without crazy downtime, so, a couple of days downtime. I often go back to work looking quite swollen, but my patients are used to me. And then there's patients who say, listen, I can't afford downtime, I don't want downtime, but I want to look better.
I think that's been a huge shift, this movement towards wanting the no downtime. I know over sort of lockdown and COVID times, we were able to have a little bit more downtime and hide away from home, but I think the pace of modern life now, and the fact that we are so face-facing in a way, yes, face forward, everything is about our faces, whether it's imagery, whether it's social media. People don't have the time for downtime now, do they?
I agree. I think I'm lucky because I share my journey online a lot. I'll have a big, deep skin peel once a year, and you'll see half my face flopping off.
I think that was you in Italy, actually.
That was me in Italy, and I'm quite open about it. But many patients don't want that downtime. They don't want people to know. So then you can have a non-ablative laser, meaning a laser that doesn't burn the upper layer of the skin. It sends heat to the deeper layers of the skin. It's also a fractional laser. We use the erbium gloss laser by Cutera. It's the secret duo, which is a 15 nanometer laser. Very well researched, an abundance of randomized controlled trials, good quality literature that shows that it's safe to use in skin of color, that it can be used in the face, the body, the hands. The body doesn't heal as quickly from lasers as the face, so it's a great treatment. And then we have the thulium laser, which I absolutely love. Thulium, we have the world's only thulium laser called the Lutronic Laser MD. There's a kind of a similar one called the Moxie laser, and this laser is a 1927 nanometer laser. It targets pigment, and it gives that kind of what you call glass skin polish, right? So it polishes the chromophore picks up as pigmentation. So as we age, our melanocytes, our pigment-forming cells, start to become a little bit dysfunctional, and it lays down pigment a little bit more haphazardly, and patients come in with age spots or sunspots or lentigines, and this particular laser targets that, so it gives this kind of beautiful uniform skin tone, and this improvement in skin tone and luminosity to the skin without the downtime. And the beauty of the thulium, it also creates microchannels in the skin. The only other one that can create microchannel is a CO2, but that has downtime. So it can be used in the face, and it can also be used in the hair if you're trying to get topicals in for hair.
So you'd apply that sort of serum after you've actually created those microchannels to get it deeper. What sort of serums would you be using?
Sometimes we use medicated ones like dutasteride. Sometimes we use minoxidil. Sometimes we use copper peptides. Peptides are huge, and I think that's something that we're going to hear more and more about. So it depends on the patient, it depends on the type of hair loss, because there's so many different types of hair loss. You have to, again, nuance and diagnosis before treatment plan.
And you can make it super bespoke, and I think that's also the key thing that we're all looking at. And we don't want the thing that is all one size fits all. It really does need to be about the thing that is right for us and our face at that moment in time. You just touched on peptides, and I wanted to finish up by asking you about sort of trends and what you think is here to stay and what you think is very much passing. What are your thoughts on peptides? And you mentioned glass skin. I mean, we're in a sort of world where trends are sort of trendy. What do you think?
Look, I think everybody wants glass skin. This is a trend. We used to hear a lot about dolphin skin. I did a big research. Do you remember?
And donut skin, weirdly.
Donut skin, yeah. Apparently, we all want to look like glazed fish. So I did a big piece of research. Francesca spoke about psyche. I am interested in the psychology of the patient. And we did a research called Beautified Britain, and another piece of research about perimenopause, the impact of skin aging on patients going through the perimenopause. And apart from the rage and the mood swings and maybe the irritability and lack of sleep and wanting to kill your partner, actually aging does have an impact on our confidence, and that's just fact. And so naturally, we all want to look good and feel good and be good and have optimized skin health. I think what's here to stay is regenerative medicine. I don't think it's new. I think it's just becoming forefront and center. What I hope, I've seen lots of trends come and go. I'm sure Monica has seen trends come and go. Trends I find quite scary because ultimately they do drive consumer behavior, and people don't know what's fact and what's fiction. Peptides are concerning. They are different to amino acids. GLP-1, Ozempic, Mounjaro, these are well-researched peptides. But BPC 157 and peptides that people are buying from random pharmacies online, injecting into their bodies, I would steer clear from. There is no evidence to demonstrate its safety in human use. And until such time that these products have safety markings on them, or CE marked, FDA approved, don't inject your bodies with them. And I think that's something, unfortunately, we are in the wild, wild west of aesthetics. We're going to see more trends come and go. This is not the first, not the last.
The accessibility is there for patients and consumers, isn't it?
Yeah, and the lack of regulation means that it is a dangerous place to be. And so for the consumer, what I would say to you is, before going to have treatment, find out, is your clinician on a medical register? Find out, is the product that's going to be injected in you medically licensed? And you can check this on the MHRA website. You can type in what product, polynucleotide, does it have a medical CE mark, which is a European kind of safety approval mark here in the UK? And that's the bare bones basics that I would be doing. Anything that does not have scientific evidence behind it, don't inject it in your face.
And then find a practitioner who you feel safe in their hands.
Yes, agree.
Ultimately.
I have to say, peptides are different to amino acids. Mm-hmm. So amino acids are safe. They are here to stay. They have been around for quite a long time. We're going to hear more about topical peptides, which are fine and safe to use in skincare, and amino acids, which are injectables. Those are fine and safe to use if they're CE marked. I use a lot of them, but the kind of the systemic peptides that is a trend at the moment with influencers online, I would be very mindful of that.
Thank you so much. That was fascinating as always. And if you have any more questions for Yusra, she'll be here at the end, and you can ask away then. Thank you, Yusra. Our next speaker is Miss Monica Fawzy. She's introduced herself already, but suffice to say she's doing some very beautiful face-focused surgeries, so very keen to pick your brains on these, Monica. But I'd like to start by figuring out a little bit, because facelifts were very much once the sort of taboo when it came to cosmetic surgery, and now it feels that we're talking about them more and more. I mean, what do you see as the plastic surgeon really behind this shift towards us embracing it much more readily?
I think it's probably talked about more because celebrities are talking about it more. And as we know, I think one of the people you were talking about has talked about her facelift a lot more. And I think it's, a good facelift is undetectable. So the public will always underestimate the number of facelifts that are happening. And so it may feel as though we're doing more facelifts now, but I don't think we are. I think the number is probably just the same, but the public always assume that, unfortunately, the public will, thankfully, actually, from my point of view, it's nice that the public assume that a facelift will be detectable, which means that my patients don't get, no one knows that my patients are having facelifts. But the fact that celebrities are talking about it more means that we're kind of, people are becoming more open about maybe sharing it with their friends and family, etc.
Certainly, and I guess we also have that sort of visual aid to say, actually, this isn't the sort of windswept look. This isn't the weird sort of frozen sort of face we thought we were going to end up with. This is actually a very beautiful, sensitively delivered result, and this is actually what a facelift can look like.
Exactly. And I can remember when I was training about 20 years ago, most of the patients would not be happy sharing the fact that they've had a facelift with either their partners or family, etc. And now that's really a minority. I'd say it's probably about 20%. So
that's interesting. They often say, the best facelift is sat across from you on the tube or something. And
right.
I love that sort of feeling of like, actually, you could be staring at somebody right now. I mean, I don't think you've had a facelift, but
No.
you could have, and I'd be going, gosh, you just look so natural and fresh. And you're right, you use the word undetectable, and I think it's such a quandary for a surgeon because you want a result that's undetectable, but as the patient, if you've gone through that time and energy and investment, you also do want to feel sort of noticeably better, and you probably do want people to go, wow, you look great. I mean, for you, that's quite delicate to balance that. So what's your starting point when it comes to the patient? How do you begin the journey with them?
So I firstly start by reassuring them, because I get the same question. So most of my patients are going to come via their friends, but the few that haven't will be, the first thing they'll say is, I just want to look like me. I don't want to look like I've had a facelift. And I keep saying, you won't, and it's fine, and I'll show them photos, etc. But if we work, I think the key is to work back towards the old photographs, because what I want, the key for it to be undetectable is for the patient to preserve what's called their facial identity. So they'll always look like they did before. So as we age, we're going to go through changes, but we'll still kind of look like us. We're just going to look like we are 10 years older or 15 years older, etc. So if you work back towards that old photograph and preserve that facial identity, then even though you can have quite significant improvements or changes or, a fresher look, people still won't know that you may have had a facelift. You can still say, I've gone on a retreat, for those who don't want to share it, or I've lost weight, or whatever it is. Or
I've cut my hair.
I always get them to cut their hair so that they kind of say, oh, it's my, the haircut's just showing off that new jawline. It's, so, I mean, the funniest anecdote is I always love it when patients will come back and tell me, what the reactions they've had. And I had a lady who went back, she's a corporate lawyer, went back to work 2 weeks later, and she said, everyone's just circling around me trying to work out what's happened, And then she said 2 of her male colleagues, so she's a very statuesque, very slim, very small-breasted lady, and that bit of information is going to be important in a minute. And she said 2 male colleagues went up to her 3 weeks later because they were trying to work out what's happened. They said, oh, we've worked it out. You've had a breast implant. She's as flat-chested as she was before, but they just couldn't, to them, the only way that you could look great or different is
what a
she
funny
must
way
have had a breast implant.
And also what a funny way to sort of almost get a compliment as well. Like, people know that something's different. What I think it is? I think it's about appearing unoperated on.
Yes.
I think that's what people are genuinely terrified of.
Yes.
I think if you say, we're taking you back to what you used to look like in your prime, when you felt your greatest, when you felt your most confident, who wouldn't want to go back to that, quite frankly?
Right. But it's interesting. It's only until you kind of show them before and afters that they'll kind of, be reassured, unless they've come through friends, etc., and get it. But what's great for me is that the public always assume that a facelift's going to look like the bad facelifts that we see online or that we see in the papers.
Yeah, you've got an easy job. You're like,
it's
no.
fabulous. It's great. So it just means that they'll never think that that fresher look or the improvement is from a facelift. They'll always assume.
And what are the techniques that you're using to deliver this undetectable result? We're hearing a lot about the deep plane facelift right now. Obviously, there are a myriad of different techniques that you have at your disposal as a surgeon. But is that the sort of be-all and end-all? Has that marked a shift in us having this much more natural aesthetic now?
I think, 20 years ago, when people had a facelift, all we had, or the only thing that we had at our disposal as surgeons was really just a lift. So everyone kind of got the same operation. So everyone came in and had a particular type of facelift, sometimes a kind of a slight variance of a deep plane, or more commonly a SMAS plication, which is a slightly more superficial plane. But everyone just got the same thing. And those who were a great candidate for that particular operation would have a really great improvement. But the rest of the population, where there were other things that we maybe should have looked at, didn't. And so I think the reason why we've got an improvement these days is that when I look at a patient, I know from the beginning that they won't necessarily just need a lift. So, for example, you'll be looking at tissue mobility. If someone's got great tissue movement, then a lift is going to really be very effective in them. If you've got someone else, mostly heavy faces, but not always, where the tissues don't move as much, then I already know from the beginning that a lift on its own won't be enough, that you'll have more of a sculptural aspect to things. So do I need to remove, for example, buccal fat pads if they're very heavy, or if they're herniated? Do I need to reduce the volume in the neck in order to almost unmask that neckline, even if those tissues won't move so much? The lift is still going to be useful, but that's probably going to contribute 20% rather than 80% in someone else. Again, you can look at areas of where you have a little bit of volume loss. Where I don't rely on fat as much as some of my colleagues, so we've all got different ethoses. And again, it's really important if someone's considering a facelift to really get a detailed plan of what that surgeon would like to do, because there's some of my colleagues, for example, who, if we're trying to rejuvenate the midface, when you're doing a deep plane, you're going to divide some of the ligaments that are holding things in place, but there's little nerves sitting behind those ligaments. And so for people who may be slightly less confident in dissecting out that nerve branch, then they will leave that in place and use fat to give the effect of
I see that they'll almost find a sort of a workaround almost.
Yeah, there's a workaround.
Yes.
And that's not to say that they may end up with really lovely results.
Yeah.
But there'll be a slight difference in longevity. There'll be just a bit different ethos.
I guess every surgeon almost finds their sort of their secret sauce or their sort of specialism in a sense, and
Exactly.
what one feels very confident doing, another might be lesser so.
Exactly. And one of the reasons why I don't maybe like using fat as much is that, the reality is, as we age or as we mature, there's going to be an element of laxity. There will be a slight element of volume loss, both fat or bone, but I think that's been exaggerated by the industry because it's an easy solution, and so in actual fact, when I actually look back at the photos, a lot of the patients who are coming in have actually got more volume than they did when they were 20 or 30. And most of the suggested volume loss is actually just because the tissues have moved. So if your tissues have moved from the mid-face or the top of your face down to the lower part, then it's going to give you the illusion that you've lost a lot more volume than you have.
Exactly.
And so when you look back, if you actually just reposition those tissues, both during the lift, but also with some of the techniques for the deep plane facelift, if I move the entry point of where I enter the deep plane, then I'll have a variable amount of tissue that I can use in different paces.
So it's almost saying that you're putting the fat or the facial volume back in the right place.
Exactly.
Versus saying, okay, we'll just leave it around the jaw and you'll be a bit heavier and we'll just add it back into your cheeks. Your
Right.
face is then not going to be going back to how
Exactly.
you were in your prime.
Exactly. And the reality is, if you actually look at yourself, well, not yourself, but most people in their 20s and 30s, they weren't super chubby faced. That's really when you were a child or a baby is going to be
the puppy
chubby.
fat, yeah.
Exactly. And most of the people are going to lose that in their teens. And so when you just purely rely on someone's tissues and reposition it back to where they should be, then you look back at their old photographs, they do look more like when they were 20s and 30s.
Exactly.
I'll reserve the fat if someone really is this a really, an unusual situation where they have lost a lot of fat, for example, with GLPs, etc., or there's some, kind of congenital
It's so delicate, isn't it? Sort of removing fat, adding fat, and actually you do beautiful work with the neck as well, and I know you touched on that earlier. There's a really sculptural element. Why is it so key for you and the surgeries that you do often to address the neck? Because a lot of people will come in and they'll say, oh, just do the neck, or don't worry about the neck, just do the face.
Exactly. And I have had to, kind of not educate, but talk someone round and kind of show them photos and show them what's possible. I think the neck's important for several reasons. My first priority is to not look operated. I don't want any of my patients to look operated on. And if you just focus on one area and then ignore the area that's just adjacent to it, then to me, that's going to give an operated look, because it's not natural to have a pulled face with a very defined jawline and then to have a really poor neckline. It's just not possible. That's not how people age.
It's that same analogy, doing one room in your house and sort of leaving everything else sort of undecorated.
Exactly. It's actually, I think it's better to not have anything done, rather
At least then it's all holistic.
Yes, and at least they won't look operated on, because to me, an operated look is worse than someone who has just got normal, natural, maturation changes.
Yeah.
That could still be graceful. You look at 80-year-olds who, have never had anything done, and to me, they still have a beautiful face, as opposed to someone who just kind of looks bizarre or looks odd because one area has been addressed aggressively and then the next hasn't. Exactly. I mean, the reality is the superficial layer of muscle in the neck actually starts out halfway up your face, and so it's just not possible for one segment of a muscle to age and then the other segment not to.
Exactly. It's like you address one thing and everything, it almost has that knock-on domino effect, doesn't it, when you reposition one sort of area of the face. And also, I think, there's this cohort of patients that we don't often talk about, and it's the younger generation of patient who you might say, gosh, 30 is far too young to be having a facelift or whatever it might be. But for some people genetically who have very sort of heavy necks, it's the only part of their body maybe where they actually do have a little bit of additional volume. Everything else might be incredibly petite and slim and what have you, but that slightly heavier neck on a younger patient or an older patient can make them look far heavier than they are, and I think that's something really important to address.
Yeah, it's transformative, and you're right, that small subset of people who will have what's called a deep neck reduction, where you're reducing the kind of extra volume in that neck in someone who's got great tone, who is young, who's had that throughout their teens, etc., is going to be transformative for them.
Are you seeing a younger patient come in? Because we keep hearing that the age of a facelift is dropping. Is that something you've genuinely seen happen in practice?
I think I've got a small but growing percentage of patients. I used to, up until about 5 years ago, I used to have a cutoff of 45, just because, I'm quite conservative, etc. I've changed that now, and I do look at patients on a case-by-case basis, starting, the youngest I've got is 39, up until the kind of early 40s. But these patients they don't look their age, okay? So they don't look like they're 39, and they don't look like they're in their early 40s. So they've either had early menopause, they've had a hysterectomy in their early 30s, etc.
Interesting.
Or I've got two patients who had significantly stressful lives that are not normal. And they did, one of them's 39, the other one's 42, but they look like they're in their early 50s, I would say. And so you're looking at them more from a physiological point of view, rather than just their age. But to be honest, the first lady who I did, she kept coming back for 2 years because I just kept pushing her back saying, you're too young, even though she did look a lot older. But the fact that the facelift was just transformative for her. It just encouraged me to kind of go, well, actually, maybe I should be looking at them just from a case-by-case basis.
Yeah, exactly. And again, it sort of goes back to not just looking at the superficial layer of the patient, but delving a little deeper. And I think you're right, sort of hormonal change, what that does to our skin, what that does to our faces. I think there's so much interesting research now going into the impact of perimenopause, menopause, what it's doing to us, particularly as women. It's almost the missing piece of the puzzle now when we're looking at our faces, isn't it? Final question, what do you sort of advocate in terms of recovery? You've spent a huge amount of time researching, going through the surgery, doing absolutely everything you can to optimize it. What does life look like on the other side for these patients, and what can they do to really ensure that undetectable result has longevity as well?
So do you mean for the first few weeks after surgery?
Yeah,
and
exactly.
afterwards?
Sort of the aftercare, the recovery, anything they can do to support, I suppose, your work themselves as patients.
So I basically tell them that the first week they'll be at home, they'll be resting their head up, they've got a cooling gel mask. For those who've had a deep neck reduction, which is kind of the reduction of the structures in the neck that would improve a heavy neck, they may have a drain for that first week. I use a special type of tape that encourages kind of lymphatic drainage in order to maximize the recovery. And that stays on for 2 weeks.
That's quite a new sort of technique, isn't it? The facial taping. I feel, it's interesting.
So I developed it just by chance because I don't know if you've heard of the quilting A-net sutures that some people use. Well, I had a patient probably about 4 or 5 years ago who was very anxious, and so I just covered them for her because I just thought she's not going to cope.
So they're quite visible, aren't they, these stitches?
Yeah,
they reduce
they
the bruising and the bleeding, but
Exactly.
they can look a little scary.
They look
suffice
very
to say.
scary, to be honest. I mean, when they first described it about 10 years ago, I remember looking at them thinking, there's no way I'm going to use this. But there is a lot of scientific evidence in, how useful they are. They will really reduce the rates of bleeding, etc. And they come out after 2 days. However, that lady just happened to be super anxious, and so I just covered them. And I just noticed that she had a lot less swelling, and so I just kind of developed that
That's
a
so
little bit
interesting.
further.
So you're taking a technique and just refining it. You
Yeah.
know, that's new.
Exactly, and interestingly, that's used by a lot of athletes when they kind of tape themselves up before they go,
Yeah.
when they've got injuries.
Yeah.
And so I'm not 100% sure exactly how it works, but I'm sure there is some evidence that activating pressure receptors in the skin will reduce the inflammatory process, and I'll certainly use that for scars, but we don't know whether that's the case for, areas where there've been inflammation underneath it. So, for example, areas that have been operated on but without a scar. So that could be one mechanism. The other one is potentially continuously improving promoting lymphatic drainage over that 2 weeks. But I've certainly noticed a huge difference now in terms of them getting back to work.
Yeah. I think just sort of moving that stagnant fluid around and sort of making sure that there's sort of minimal sort of swelling as a result.
Exactly.
And also that's what makes the patient feel more comfortable as they start to recognize themselves in the mirror again.
Yes.
I think psychologically when you don't look your best and you're sort of confined to being at home recovering, it's almost like you tell the body, you know, you're injured or you're sick. And actually I think for us to have that healthy recovery, we need to sort of see it visibly sort of happening in front of our eyes.
Yeah. And get going quickly.
Yeah, exactly. Get back on your feet. Get out there with your sunglasses.
Exactly.
Amazing. Thank you, Monica.
It's a pleasure.
Super interesting. And any questions for Monica, feel free to ask away at the end. Our final speaker is the amazing Mina Lee.
I've been waiting for a long time.
Yeah, I know,
so
sorry.
nervous, keep
That's why I
building
get
up the
everyone to
nerves.
introduce themselves at the beginning, because otherwise I'm like, God, you're here for an hour and you barely even say anything. Mina is the most magical facialist. She's very adept at blending the sort of high-tech therapies with the very hands-on healing techniques. You're going to hear all about it. But Mina, maybe you can tell us a little bit about the women who come to see you, because I'm sure every woman in this audience would almost recognize themselves in your cohort that come to spend time on your treatment table.
I'm just looking, any of my clients are here. So I've been practicing for over 20 years, but I opened my practice and during the lockdown, and then everybody shut it down, and I thought I couldn't handle pressure with my husband, my daughter, my cat. I needed my space. So I opened one for purely I want to escape from my family. And then when I opened it, it's always good accidents happening for a reason. When I opened it, only one goal, whoever want to come to my table, I want to have a proper pamper and a rest. And then that was one by one happened, and then now it's over 2 years waiting list. People who come in to see me is that they just want to have a bit of a healing, because all of us carried something in us. We went through quite a lot, and then that's actually showing in our face. So the person coming in for the facial is not just for the facial, it's just for something extra. And that's the people who come to me in my door. And whoever enter my door, I look after them for 90 minutes.
She really does, honestly. You're all going to book in with her afterwards, I'm sure, when you hear her speak. But it's a very special sort of time on your treatment table. And I think you're right, it's what we all need. And I think the other thing to note is how precious time is and how little of it we have. So when we do dedicate that 90 minutes, there's a hell of a lot that we want to take off our to-do list.
Exactly.
It's not enough just to say, I've got the glass skin now. No. I also need to feel
exactly, you have
reborn.
to feel.
Mina, you start people, which I always find very surprising, for a facial lying down on their front, so face down, which is obviously not what you would expect, but tell us why that is. What are you doing at the beginning of the treatments?
Discovered my method of the starting in the back, because all our back, whatever I talk to my patient, what's the matter? And it's my bad neck, my shoulder, but everything is your body is a whole one thing. It's not only face. The face is what you're showing inside going on in your body. Your muscle tension of the body, your internal organ inflammation, or anything happen is the face is a mirror of everything. And in the back of the body is the Chinese meridians, all go past, and it's easy to analyze for your body condition. So therefore, I normally start with the back of the body, touch the feet, and touch the leg and touch the back of your top of the spinal. And then we turn around and we start with a tummy inflammation check and make sure you don't have any inflammation inside the intestine or liver area. A little bit touch on the castor oil massage, and we analyze it. And then with that, it's already my patient is relaxing. And then they feel like I felt a bit care. Rather than somebody lie on a couch doing a facial, like clean the face, step 1, step 2, step 3, put the mask on with the LED and finish.
I think also we've come to the realization we can do all of that stuff ourselves at home, and we all did it in lockdown, didn't we? We're all experts
at,
sheet masks and peels and whatever, we were
step
or shouldn't have really been doing.
Exactly.
So I think, yes, when you're in there, you want that extra level. But I think you're right, the face is very much connected to everything else that's going on in the body. I mean, you even sort of massage the ears, which is, sort of relevant in traditional Chinese medicine, isn't it? Which 100%. You incorporate.
I find that everybody is connected. So when I do it, I did a foot massage, a hand massage, an ear massage, because the ear is quite phenomenal. You can see. Do you ever touch your ear? Yeah, it's quite. Some people said a very sexual thing, so it's like they don't want to touch it. But for me,
some people are weird about ears.
For me, I really it's very important to lifting your face muscle. Without releasing your ear muscle, it's very difficult to release your jaw masseter, and as well as the hair, the scalp muscle. So always connected with the ear, and also ear has got all the reflexology of the point of the internal ear organ connected. So while I'm massaging your ear, it's not only lifting your face, actually your inside reflexology is the point. So therefore, it's not missing one. So you must have ear massage.
So it's sort of recalibrating the whole body, but it's also lifting the face, which is really and actually, what's really clever is Mina works on one half of the face first, shows you a mirror, and honestly, your jaw is sharper on one side. You even pressed on my eyeball at one point, and you said your eyeball needs to get, you need to sink it down. I don't know, everything you were doing was kind of nuts, but it was amazing. And I looked in the mirror and I was like, this side is higher, definitely. And then luckily you did the other side, so I was all brought back into balance.
Yeah, can you imagine? I picked one side.
Yeah, exactly. Now off you go. You do that to the patients you don't like so much. When you've got somebody lying there on the treatment table, you also do things like Reiki, you do acupuncture. Why do you sort of instill those techniques, and what are they doing for the skin and for the face?
I think generally from my experience, so I had a very bad acne since when I was 14, so I've always been suffering the acne and then problem skin. And then when I came over to England when I was 25, I flared up again, and then I thought, okay, I need to do something. And then that's how I discovered a more aesthetic side. So I become qualified beauty therapist, and I'm working in a clinic, work with all the laser, chemical peel, plastic surgeon, a dermatologist, all to cure my skin. And as soon as I got pregnant, you're not allowed to touch any of it. Even you can't even touch the exfoliator. And your body is not your body, and then start to flame again. And I thought, okay, I need to cure myself again with a different way. That's how I discovered the holistic side, and then Chinese acupuncture, or like a reflexology, cupping, Reiki, anything. And then you pass that, and you hit the menopause. So you actually never have a break for yourself. You actually puberty, pregnancy, and a menopause. My skin is ongoing, targeted to heal. And then I find it the way to heal your body is have to be combination. You can't have one thing. So I do, my clients they come in all individual different lifestyle. I can't do the one manual. So I have to understand what their body and what's their lifestyle. So some people, client need acupuncture to be relaxing more. Some client is okay with the massage. Some client just need a cupping for the release the inflammation. So I find it having all this knowledge in one pot, and then I can pamper my clients in 90 minutes properly. So that was a bit of the key trademark for my brand. So I think that's from the whole my experience. If it wasn't needed I wouldn't learn.
Yeah. But you also say even clients who have been seeing you for years, they've never had the same facial twice.
Never.
It will always be different, and it will always be responding to what their face needs in that moment, and their psyche as well at the same time. I find it interesting because you mentioned you've worked with the lasers and the peels and the derms and the surgeons and whatnot. Is that still part of your ethos? All of these
100%.
things complement one another?
Yeah, clients are coming in and out all the time, and then to be honest, most of my clients high profile, they travel everywhere like you, and then I said it like, please don't do the Botox. They would turn around and they go to sit with the Botox, right? So I find that whoever does it, and then you have to find the right doctor, right amount, and the right place. And then I always, one of my clients has done it quite big Manjaro, so she lost quite a lot of weight. And I said to her, like, I think you shouldn't invest on any of it. You really need to cut up your skin. So you really need to have a facelift and neck lift. So I am actually looking at the client as a perspective of me, what I go through. I always give the honest opinion. And if some client really gangster of the injectable, that means I will introduce the holistic doctors on the medical of the functional medical and nutritionist to help. But if somebody need a Botox, then I need to find the best doctors I can suggest, or the plastic surgery. I always combine it. And also in our clinic, we have a software because after 45, your jaws
a bit wobbly.
So I needed something for myself. So I tried every machine and I love the software, so I just bought it. So everything I have in my studio is it goes through me. So they have to be past me, and then all the products in front of you as well. There, the Piderin, that product is my babies. I imported from South Korea. I had such a bad rosacea, and then menopause going through the past. The skin is getting very uneven. So I discovered this, and I loved it so much, and actually bring it to UK. So you will really enjoy that Korean.
It's very, very hot off the press. I feel like you've only just brought it over, haven't you? And there's a whole range. There's an amazing bubble cleanser. There's a toner. Some of you have the serum, which I think has the microspicules in it. So it's sort of like a nighttime product. And those little microspicules needles get into the skin and plump it. And I swear my fine lines on my forehead, until I can get back to having my Botox again, are so much smoother as a result. But it's the cream that gives you the glass skin.
Yeah, the cream has got the amazing. It's also PDLN, is a polypeptide nuclear, and it's a pentanol and peptides, all the like a kind of anti-inflammatory agent in there. So you can actually using cream the day and night, and then ampoule is only recommended for the evening.
It's so interesting because all three of you have picked up on sort of inflammation, and whether you're using it in the sort of in the skincare, reducing it in the aftermath of the surgery, using it in your treatments, reducing inflammation through laser. It's fascinating how it all comes full circle. Final question, Mina, and then I think we'll open up to some audience questions as well. I feel like in the Western world we are all fascinated with Korean skincare, the rituals that you have, the ingredients that you're using. Why is this? What are you doing that's so different over there? What are we doing that's so different? And I suppose, what can we learn? What are you trying to bring from Korea to our faces?
I think most of my clients ask me is Korean K-beauty, glass skin. I always ask it wrong question because A, you're not Korean. So you're not gonna get that thing, and then B, we actually.
So stop there.
So like genetically different. You're born in differently. We're eating differently. We are like environment differently. We don't use radiate in Korea. We all underfloor heated, and then also the food that is subsidizing is more like more fattening than UK, and then also our fat tissue is much thicker than you guys. So I find that you have to target differently. And also Korean beauty has always been working on prevented because our melanocyte is much sensitive. If anything happen and become pigmented so easily, so they're always working on the barrier repair, and then always been like prevented to make sure whitening, antioxidant, and then like a niacinamide. So always been like this, and for a long time, and then suddenly K-pop and K-drama hit the world, and everybody's, is it all Korean has good skin? Of course not.
You're like, we've always had the good skin. You guys just didn't know.
Yeah, I had acne all my life, so people have a variety of difference. I think it's the most important thing is you have to find the right product for you, and then what is the best for you. And then it's less is better, and you find the correct product, and then like a regular routine of yourself is more important than anything else from my experience.
Exactly, finding the thing that's bespoke to you.
And also treatment. All the Korean, if you go look around, like 1 in 3 has Botox or plastic surgery or the Regeneron polypeptide nuclear. It's just around the corner. It's just going to the. I'm going to have a Botox done just around the corner. It's like they got.
It's just part of your maintenance. It's like having your nails done.
Yeah, exactly. So
yeah,
it's just
I heard that sort
natural.
of. I think it's sort of like everyone under the age of 25 is already sort of considering
they
their
all
first
have done.
upper lip blepharoplasty. It's
Oh, but that is one of the reasons we are a little bit different, because we got almond eye shapes. I mean, I haven't done it, but then my mum has done it, my brother has done it. So we are family of 5. It's 2 already done plastic surgery.
It's just responding to sort of what your genetic code is as well, but also sort of maintaining that idea of what's right for you and your skin. And I think that's something to bear in mind, no matter what the trend is at any given point. I'm going to stop talking because I feel like there's probably lots of questions, and Thomas is going to kick us out otherwise. But suffice to say, that was fascinating, all 3 of you. And like I say, it's always really interesting to have these conversations on stage, because you start off with very disparate speakers, and then you realize at the end, everyone is speaking the same language. We're all working towards the same shared goal. And I think what each of you has really emphasized is that it's not about new for newness sake. It's actually just finding a way to look at those things that have the credibility, that have the data behind them, that are truly innovative, and find ways to make those relevant in the here and now. That's when it's going to feel very new. Oh, we have a background change. That's nice. I feel like we're outside now. Deep breath. Oh, thank you. That's better. Are there any questions from anyone in the audience for any of our doctors? This lady in the front here.
Hi. My name is Irana. Thank you very much for the talk. It was really, really interesting, and I learned a lot. I have, several questions, but I have to limit myself.
The speakers will be here afterwards as well, so you can grab people.
Thank you. I would love to hear, maybe from Yusra, what you think about NAD, and what all your favorites, it could be gadgets, treatments, creams, or anything, what you personally love.
NAD thoughts?
Yeah, okay. So NAD is a big topic. So NAD plus is basically stands for nicotinamide adenine dinucleotide. It's something that we all need in order to survive. It is essentially, it's made within the cell. And it's taken up by our mitochondria, which are the little organelles that are like the battery or the powerhouse or the engine of the cell. And as we age, our NAD plus naturally declines. And it has a half-life of about 10 years. So every 10 years, it reduces. So by the time you are 20, half of your NAD is gone, and then thereafter, every 10 years, it halves. And scientists know there are 12 hallmarks of aging, meaning 12 cellular processes that scientists have realized are attributed to aging, because all aging starts within the cell, right? We don't just develop lines and wrinkles. It means our cells are becoming dysfunctional. One of the things that become dysfunctional is the mitochondria. So the mitochondria become big and groggy and don't do their function as much. And NAD has been looked at scientifically for quite a long time. And we now know that NAD can actually reduce biological aging. So there's a difference between biological age and chronological age. Chronological age, let's pretend I'm 20. I've been around for 20 years, chronologically. But biologically, if I'm stressed, childbirth, difficult life, domestic violence, there are many, many factors that can mean that biologically you're aging faster, which is why we see women who've gone through stress or childbirth or whatever have aged a little bit faster. When you're taking NAD plus as a precursor, it can slow down your biological age. But how you take it is very important, because your body cannot absorb it as a whole. Okay, it's quite a large molecule, so it can't get within the cell. And so NAD plus has been touted to be taken as an IV. I would say stay far away from IV NAD plus. There is no good clinical evidence to suggest that it's safe. People who have taken NAD plus IV will often tell you that they feel very sick, very nauseous after taking it. It cannot get into the cell. The only places that it will be absorbed is in the brain, because the blood-brain barrier is quite permeable, and in the heart. But the rest of it is just expensive waste. You pee it out and can make you actually sick. And now there are some publications in pre-publication and one publication that's come out that shows that IV NAD actually increases inflammation in the body. So IV NAD plus is a hell no. Stay away from that.
What do you recommend? How do you take it?
I take it as a precursor, and you can either take it as a subcutaneous injection, which is expensive, or as a precursor orally, which is very affordable. I take it as a precursor. I take a product called Nuchido Time Plus. It's got niacin in it. It's basically your body. It's the same as amino acids. When you give the body the building blocks, the Lego pieces that it needs, the cells take up this niacin or niacinamide or NMN, but niacin is very good, into the cell, and it makes it. Your body is capable of making it. You just need to make sure that you're taking it. There are certain things that your body can't make, like essential amino acids, which is why we need to take it from outside, and NAD. And you can take it from, if you have 30 different fruit and veg a week, most of us are not, so take a precursor like niacin. Nuchido Time Plus is a good one.
Fun fact, you can buy it on the Beauty Triangle Boutique. Look
There you
online.
go. And then
Shameless plug.
As for which treatment I absolutely love, one of the first devices that I bought was Ultracell, which is quite big in Korea. It's actually a Korean device. It's by a company called JC's, and it's a high-intensity focused ultrasound device. You might have heard of Ulthera or Ultherapy. I don't like Ulthera and Ultherapy because it can send heat into the fat and it can cause fat loss. And actually, we need our subcutaneous fat to support our tissues. So I don't like that because it's too much heat in an uncontrolled manner. And so the way that the heat comes out of what we call the transducer, the head of the device, is important. Ultracell is very safe. It sends heat spots into the muscle, helping it to reposition. I do it about once every 18 months. More is not more, less is more. This gradual repositioning of the tissues in a controlled manner with not over too much uncontrolled heat is great. So for me, it would definitely be Ultracell, something I've been having yearly for about a decade.
It's one of those nice sort of stealthy treatments, isn't it? You sort of forget you've had it, and then all of a sudden you're like, wow, this is looking a bit
And
sharper.
my brows, it
Yeah,
lifted
yeah,
my
yeah.
brows.
Monica, any favorite treatments?
I literally will send all my patients after surgery to these guys, and then I'm terrible. So, but I'm going to have to, I keep telling myself,
You're going to be
I need
getting
to
on Mina's
start
treatment
soon.
table, so yeah, don't worry, you're in good company here. They'll look after you. Mina, anything?
For me, it's the microneedling is essential. For me, it's like it's a anti-inflammatory effect. So when you cut your cell, you heal, you produce collagen and elastin. So I love microneedling treatment. So all my facials cooperate with microneedling. We do like exosome or polypeptide nuclear, and I am taking NAD. Since I've been taking NAD, I actually had a single cold, so I really truly
That's so
believe in
interesting.
supplement NAD. But I do love microneedling treatment.
It's so easy. There was a question at the back, I think. I definitely saw a hand back there. Were there any more questions? Oh, if not, there's a lady in the front.
Hi there. Thank you so much for this. Super helpful. I'm a bit like you, a bit clueless. So for example, talking about lasers, you mentioned like some lasers are tougher than others. If downtime is not a problem, what would be your favorite? When I put laser on Google, I have like 10,000
different
things.
lasers.
And
It
people
really
start
depends.
chasing me to book lasers, and I'm like lost, and then I don't do anything because of so
'Cause it
much
can be so overwhelming.
misinformation.
So it depends on what we're treating and what outcome you want. If it's periorbital, so around the eyes, if you have laxity, then you need skin contraction. And for contraction, nothing beats a CO2 laser, but there is downtime associated with that. If it is pigmentation, then you might be thinking about a pico laser, which is a laser that shatters pigment, or a thulium laser. So it really depends on what you want to achieve. I would say start with the
For the
concept.
firmness one that they say.
With
rejuvenating
downtime or no?
firmness.
No,
With
with downtime,
Yeah.
she doesn't. CO2 laser. CO2 laser is gold standard. No downtime, non-ablative Fraxel 1550 laser.
You're like every doctor's dream. I don't mind. I don't mind
Yeah,
the
anything.
downtime. You're like me. I don't care. Were there any other questions? Yes, this lady here.
Hi, my name is Dr. Haram Kim, and thank you for the talk. It was very helpful. I'm curious about the opinion about the plastic surgery, for example, and I want to ask a question to Dr. Monica. And in terms, lots of patients come to me and ask about laser and also thread lifting. In terms of getting the plastic surgery as a final choice, does the thread lifting or the laser impact the surgery?
Yeah, I always hear a lot about thread lifts. Do thread lifts impact surgery, facelifts?
The answer is yes, but we've found a way around it, if that makes sense. So, I mean, I'd say 90% of patients who come now for facelifts are not version faces. They've pretty much tried absolutely everything under the sun and would have had thread lifts either once or more than once. The problem with thread lifts, what I'll tell people is we'll carry on, but we may need to alter the intraoperative plan. So the issue with thread lifts is that you can get SMAS defects with it. So depending on who's put it in, etc., you can start out with a very fine tunnel that over time expands. And so it just means that that layer that we would normally be using to lift may have little kind of segments that are basically defects within it. Depending on where it is, etc., we just need to alter that plan. But yeah, so that's number one. It doesn't mean that someone can't have a facelift, but it does mean that there's kind of caveats in that I'll tell them that I may need to change that plan intraoperatively based on what we've got. I've seen a few threads as well into muscle, near nerves, etc. So again, that may alter things a little bit. With regards to lasers, it depends on the laser, and as you've alluded to, depending on what the type of laser is, it may or may not have caused some scarring in the deeper tissues. And so again, if that's the case, then it just means that it takes a little bit longer. It doesn't mean they're not going to need, have a facelift, but it just means that it may take a little bit longer for that dissection, depending on the situation. Yep.
And do you often send patients for laser post-surgery to sort of resurface the skin as well? Because that's the thing they always say as a surgeon, with your scalpel, you can't affect the sort of quality of the skin, can you?
Absolutely. So once I'm done, they'll have kind of trusted colleagues like those on stage, and basically say, right, depending on what you need, I'll just send you to different people for the final result, to improve that final result, basically for tissue quality. So I could reposition tissues, but I can't alter that quality, and this is where both of my colleagues would come in. So either lasers or kind of maintenance stuff like the injections.
It's playing to your strengths as a practitioner, isn't it, as well, and sort of recognizing where your skill set begins and ends, and then saying,
Absolutely.
And now over to the next pair of very
Absolutely.
capable hands.
Yeah.
Can I expand on your question? Because actually there was a publication that just came out about 6 months ago. I don't know if you've come across it, where 70 surgeons, I said about opinions being like buttholes. So basically, there were about 70 surgeons that were brought together in America, and we call this a consensus report to say, hey, what's your opinion, what's your opinion, what's your opinion? Very respected surgeons. And of these 70, they asked them, does Sculptra impact a facelift surgery? Would you still do it? Does a thread lift impact it? Does Radiesse impact it? And the answer is yes, but the proximity between the intervention and the surgical intervention makes a difference. So these surgeons said when it comes to biostimulators like Sculptra and Radiesse, they do change the underlying ecosystem of the tissues. And what happens when they're doing surgical intervention is it can be harder to see where the facial nerve is and dissect it carefully. But it's very important that the patient and the practitioner is honest when we're referring our patients to say, this patient has had this intervention, because then they'll use their clever tools to identify the nerve, and it might be like an electrical stimulation tool. All of the surgeons actually, bar one, said that they would still do surgical intervention in patients who had these interventions. All of these surgeons agreed that 6 months was the right time. That was for biostimulators. I'm not sure about thread lifts because I don't do any thread lifts anymore. It's not don't like them.
I agree with that, but interestingly, it also depends on who's done the sculpture, where they've put it, what layer they've put it in, and unfortunately, patients don't have that information. And so I've seen people come in 2 years, 3 years post-sculpture, but had a big ball of scar with their nerves going in, just because whoever put it in right.
It's not often. It's often not the products. It's the hands that are using them,
exactly.
Right? Yeah. That's the one thing you have to take away from all of this.
This is a big problem, actually, and you're absolutely right, because I'm a trainer for Sculptra as well and for Radiesse, and when we're teaching it, and when I'm performing it, and in this country anyway, medics will be injecting it in the subcutaneous plane, meaning just underneath the skin. Unfortunately, what we're seeing in America a lot, they're using it in all layers of the face. They're injecting it deep on bone and subsmass under the muscle, which is not something I will 100% interfere with deep plane facelifts and so on. So off-label. Over here, I've actually come across people who are injecting it at the wrong reconstitution. So instead of 10 mils, they're doing it at 5 mils, which is going to cause scarring, and it's going to cause nodules and going to cause problems. So where you go for these interventions is so, so, so important. I cannot tell you how important. I can't stress enough, because when you're injecting these treatments, you're changing the ecosystem. So they have got to be injected at the right reconstitution and at the right layer in the right amounts, and honesty with the surgeons when you go off to have that surgical intervention.
But I think the issue at the moment regarding honesty is a lot of people don't know what they've had done. So they'll go to someone, they'll just go, do whatever you think is best, etc. And so a lot of the times, even after a facelift, I'll go back to the patient and say, you've got sculpture in there? They go, oh, do I? And you know, really don't know.
Yeah.
And so it's not almost not their fault. They just literally
But whether
don't
they're
know.
saying to the doctor, do what you want, or whether they don't feel that they can question the doctor, I think we still come across that with consumers. You know, we're always told, speak to your aesthetic practitioner, your surgeon, your practitioner, ask them what they're using. I think a lot of us still feel, but they're a doctor, they're a medic, they're a professional, I can't question them.
Or
And
they're
that's something we really
confused.
need to break
They're
down.
confused.
Yeah.
You know what can happen? So what we do in clinic is we give our patients a passport. So it's like a little treatment pot, and you can ask your clinician for this to say, do you mind telling me what I've had? There's nothing wrong with that. And
I love the idea of a passport. Sort of like,
Yeah.
I mean, it's like your vaccinations,
It's
isn't
your
it? You sort of having them
exactly.
all sort of written down in the
Yeah.
same format. It's genius.
So you've got what product you had at what layer, and the ethical practitioner will be delighted to support you in that. Yeah, because actually how are
That's
patients
very
supposed
rare. That's amazing. I would love for everyone to come in with that. Yeah.
Your job will be so much easier, Monica. Super. Were there any more questions? Oh, this final lady here, I think. Is there a microphone? Oh, thank you. It's just this lady in the front.
Thank you to all three of you. That was very insightful and informative, so really appreciate that. Thank you. I've got two questions. One's to do with microneedling and frequency of microneedling, and is that on the face and neck or just the face? And the other question is to do with Morpheus 8. I heard someone told me Morpheus 8, because of the radio frequency, can reduce collagen, but then I've heard otherwise. So
I'm
Do
happy
you want to
take
start
that.
on
Do you want to
Morpheus
start
8?
with,
You do
should I-
microneedling.
Should I start on Morpheus 8?
No, you start.
Okay. Do you want to start on microneedling? You
Yes,
start on microneedling.
start on microneedling.
Microneedling, I normally recommend it every 3 weeks to the cycle. But if you want to do the home microneedling, please be careful. Have to be disposable. Once you use it, you have to throw it away. And then before you do it, you have to be cleaned thoroughly. And then also using ampoule, what you're using have to be sterilized. Either a new bottle you need to open, or something has a sterilized bottle you have to use. And then I definitely recommend it once every, if you do the home microneedling, its depth is 0.25, it's maximum you can get. But when you do that, probably you can push the once every 2 weeks. But at the clinic, if you do, I definitely recommend this once every month, regularly once every 3 to 4 weeks, have a regular, that you can, when you reach the 3 to 4 treatment, you really see the depth of the skin qualities change, and your pores be tightened, and the quality of your skin is generally more improved. You will see it.
Thank you.
So Morpheus 8 is radiofrequency microneedling. There are different radiofrequency microneedling devices out there. Morpheus 8 uses a specific type of radiofrequency called bipolar radiofrequency, which means that the heat energy goes between the needles. It can create quite a lot of heat in a very small area. And the issue traditionally is that Morpheus 8 was kind of delivered from doctors to non-doctors all across the country. And so a lot of the problems that arose from Morpheus 8 was uncontrolled amounts of heat in very deep layers of the tissues, which caused unwanted side effects like fat loss, because heat in the deeper layers can cause fat loss. I personally don't like Morpheus 8. I used to have a device, I gave it back, and I now have a Cutera Secret Pro and a Secret Duo, which is much more controlled using microfine gold-plated needles. But at the end of the day, radiofrequency is a very well-researched treatment modality. It's kind of come back full circle now because of Kim Kardashian having ZERF, which is a monopolar radiofrequency. And radiofrequency on its own, very safe, very well tolerated, excellent treatment to increase heat in the tissues that stimulates collagen production, as long as the heat is at a specific temperature between 41 to 42 degrees and limited to a depth of about 2 millimeters. When it goes beyond that, that's problematic. Because Morpheus 8 uses needles that can penetrate up to 7 millimeters, in the wrong hands using it in deep layers, it can cause problems. Ultimately, all of these devices, used well, in the right hands, in the right safety parameters, will yield positive outcomes, but in the wrong hands are dangerous. So radiofrequency microneedling as a modality alone is not problematic if it's kept superficial, very superficial, 1 to 1.5 millimeters. Deeper than that, I think, is problematic.
Thank you. Very articulate as always. I'm really sorry we've had time called, but all of the speakers will still be here, so do grab them and ask them any questions that we didn't manage to get to this morning. A very big thank you though to everyone who stayed. Don't forget your Pidarin products. Yes, I can see everyone leaving with them. Excellent. Your face will be so excited when you start putting that on there. And yes, a very big thank you for joining us. Come back and see us. I think we're back again in a few months doing talks. Otherwise, you can leave your details on the referral cards, and we'll connect you with people. We'll tell you when the next events are coming up. And a big thank you to Annabelle's as always for hosting us so beautifully. A big thank you. And to our amazing beauty triangle, most importantly.
Thank you, Francesca.